Right now, before you do anything else, hold up one of your hands and take a careful look at it. Not a passing glance, a genuine examination. Because over the next few minutes, I'm going to reveal something most people over 60 have never been told. Something cardiologists rely on every single day but rarely take the time to explain to their patients. Your fingernails are silently documenting what your heart and blood vessels are doing. They've been doing this throughout your entire life. And if you know precisely what to look for, they can alert you to a cardiovascular crisis before it ever strikes. I'm Dr. Dan Carter, and a significant portion of my work has centered on preventative cardiovascular care for adults over 60. Over the years, I've witnessed something in clinic that genuinely troubles me, again and again. People arrive after a heart attack or a stroke, and when I examine them closely, the warning signs were already there, on their nails, sometimes for months or even years before the event. Nobody had noticed. Nobody had told them what to watch for. That stops today. Stay with me through the end, because the final sign I cover is the one that catches most people completely by surprise. Before we go any further, I want you to do something in the comments right now. Type your age and tell me whether anyone in your family has ever experienced a heart attack or a stroke. Your answer will shape how urgently you need to act on everything we're about to discuss. And if this kind of content is valuable to you, please hit the like button. It genuinely helps me reach more people who need this information. To understand why your nails carry this information, you need a little background biology. Your nails grow from a structure called the nail matrix, situated just beneath the base of each nail. The cells in that matrix are in direct, constant contact with your bloodstream. They're nourished by the tiniest blood vessels in your entire body, the capillaries running beneath your nail bed. And because those vessels are so remarkably small, they're among the very first structures to show strain when your cardiovascular system begins to struggle. Think of your nails as a live monitor that your body has been quietly running every single day. After 60, the reason this matters even more is that the body's capacity to compensate for early cardiovascular problems becomes significantly narrower. In your 30s, your heart can quietly work around dysfunction for years without anything visible occurring. But after 60, those reserves are thinner. Warning signals begin to appear earlier, and your nails are often where they first surface. The problem is that a typical 15-minute doctor's appointment can't cover everything, and nail examination rarely makes the priority list unless something is visually alarming. So the information exists in medical research. It just never reaches the person at home who actually needs it. That gap is exactly what I want to close for you today. Sign 1. Terry's nails. This isn't a term most people have ever encountered, but once you know it, you'll look at every pair of hands differently. Terry's nails appear when the entire surface of the nail takes on an opaque, whitish, or very pale appearance, almost like frosted glass, with one defining feature at the very tip. There's a narrow band of pink or reddish coloring at the far edge of the nail, typically just a few millimeters wide. That strip at the tip is the key marker that distinguishes Terry's nails from ordinary pale nails. Now, here's why this matters for your heart. Research published in Cardiovascular Medicine has identified Terry's nails as significantly linked to coronary artery disease, heart failure, and diabetes. One study found that people with Terry's nails had an odds ratio exceeding 6 for coronary artery disease compared with people without them. That's not a minor statistical curiosity, it's a major signal. And all of the conditions associated with Terry's nails share one trait. They develop slowly and silently over years before anything dramatic occurs. A patient I'll call Arthur came to see me at 71. He had no dramatic complaints. He felt reasonably well, but had been somewhat more tired than usual, which he naturally attributed to age. During the exam, I noticed his nails looked unusually pale, with that telltale reddish band at the tip. I asked him some careful questions, ordered an echocardiogram, and the result revealed early-stage heart failure that had been developing for nearly 2 years without any obvious symptoms. Arthur is doing very well today. He received the right treatment at the right time. His nails were the doorway that opened that conversation. Sign 2. Lindsay's nails. This one has a very distinctive appearance that you'll recognize immediately once you know it. Lindsay's nails are sometimes called half-and-half nails because the nail is divided into 2 clearly defined zones. The half closest to your cuticle is white or very pale, while the half closest to the tip is a brownish red color. The boundary between the 2 zones is usually sharp and distinct. Lindsay's nails have been linked in clinical research with heart failure and with liver cirrhosis, and they tend to emerge after the body has been under sustained circulatory stress for some time. The reason I'm covering both Terry's nails and Lindsay's nails early in this discussion is that they're both disorders of nail bed color, reflecting how effectively blood is actually reaching and nourishing the smallest tissues in your body. When circulation to the fingertips is compromised over a prolonged period, the nail bed loses its normal pinkish hue and starts displaying these altered patterns instead. Both signs are visible in ordinary daylight without any special equipment. If you hold your hand under good natural light right now and look carefully at each nail, you can check for both of these signs in under 30 seconds. Do it now while the descriptions are fresh in your mind. Sign 3. Mierke's lines. These are multiple horizontal white lines that stretch across the nail, running parallel to the lunula, the small crescent shape at the base of your nail. Mierke's lines don't feel raised when you run your finger across them. You can see them clearly, but you can't feel them with your fingertip. This is one detail that helps distinguish them from other kinds of nail ridges. They're a visual signal, not a textural one. What makes Mierke's lines particularly significant is the research behind them. A study examining the relationship between nail findings and cardiovascular disease found that Mierke's lines were a statistically significant predictor of heart failure, with an odds ratio approaching 6. That means the presence of these lines in a patient made heart failure substantially more likely. The underlying reason is that Mierke's lines reflect low albumin levels in the blood, a marker of the body being under sustained nutritional and circulatory strain. When the heart is struggling to circulate blood efficiently, the rest of the body starts to feel the effects. A patient named Evelyn came to see me at 68. She was active, she wasn't overweight, and she genuinely felt fine. During the visit, she mentioned almost in passing that she had noticed some horizontal lines on her nails over the previous few months. She figured it was probably nothing. I examined them carefully and recognized Mierke's lines across several fingers. I ordered a cardiovascular workup and uncovered early heart failure that was entirely manageable at that stage. The lines had been appearing for months. They were her body's way of asking for help. Sign 4. Beau's lines. This one tells a very different story from the others. While most nail signs build up gradually and reflect chronic conditions, Beau's lines emerge following a specific event. They're horizontal grooves or depressions that run across the nail plate. They appear because when the body undergoes a significant physiological shock, whether a heart attack, cardiac surgery, a severe infection, or any other major health crisis, the nail matrix temporarily halts production of new nail tissue. When growth resumes, the pause leaves behind a groove in the nail. What makes Beau's lines clinically important is that they can reveal a past cardiac event that the patient themselves may not have recognized at the time. Silent heart attacks are more common than most people realize, particularly in older adults. A patient named Raymond came to see me for something entirely unrelated. I noticed a clear horizontal groove running across nearly all of his fingernails. I asked him about it, and after reflecting, he remembered being severely ill about 4 months earlier with what he had assumed was an unusually bad case of the flu. We ran some tests and discovered he had suffered a silent heart attack during that illness. His Beau's lines told the story his symptoms had not. Sign 5. Splinter hemorrhages. Now I want to shift to something you can check directly beneath the nail surface rather than on top of it. Splinter hemorrhages look precisely as the name suggests, like tiny dark splinters or thin dark lines running vertically beneath the nail. They're actually small collections of blood trapped in the nail bed capillaries. And while a single splinter hemorrhage caused by bumping your hand against something is nothing to worry about, multiple unexplained splinter hemorrhages across several fingers is an entirely different matter. Classically, in medical training, unexplained splinter hemorrhages across multiple nails are associated with infective endocarditis, an infection of the inner lining of the heart's chambers and valves. This condition develops when bacteria enter the bloodstream and adhere to damaged heart tissue. The infection causes tiny clots to break off and travel to distant blood vessels, including the minute ones in your nail bed. Infective endocarditis is a serious condition requiring urgent medical attention. A patient named Ruth noticed these dark lines on several nails and mentioned them to me almost as an afterthought. She was diagnosed with a heart valve infection that was caught in time to treat effectively. She told me afterward that she almost didn't bring it up at all because she thought it was nothing. If this has been valuable so far, I want you to do one thing right now before we continue. Hit the like button. It takes 1 second and genuinely makes a difference in whether this content reaches others who need it. And stay with me, because the next 2 signs are the ones I want you to take most seriously. Sign 6. Lunula color changes. The small whitish crescent at the base of each nail is called the lunula. Most people regard it as just a cosmetic feature. It's actually the visible portion of your nail matrix, the active zone where new nail cells are being formed around the clock. And the color of your lunula is one of the most overlooked diagnostic signals on the entire body. When that color changes, it's worth paying attention. Research has found that a reddish lunula is significantly linked to valvular heart disease and to congestive heart failure. A bluish or purplish lunula suggests problems with oxygen delivery in the circulation, similar to the cyanosis seen in more advanced cardiovascular disease. A lunula that has faded almost to invisibility or turned very pale is often a sign of anemia, and anemia is directly connected to cardiovascular strain, because an anemic heart has to work substantially harder to compensate for the reduced oxygen carrying capacity in the blood. All 3 of these color changes warrant medical attention. I want to tell you about a patient named Constance, who was 74 years old. Her daughter, who happened to be a nurse, noticed during a visit that the half-moon shapes on Constance's nails had nearly entirely vanished. Constance hadn't noticed the change because it had unfolded so gradually. She had been looking at those nails every day and simply adjusted to the new appearance without realizing anything had shifted. Her daughter encouraged her to bring it up at her next appointment. We performed a complete blood count and a cardiovascular workup. She was significantly anemic and was showing early cardiovascular strain. Both issues were caught and treated before anything serious developed. Sign 7. The capillary refill test. Now, let me teach you a test you can perform on yourself right now using nothing but your hands. It's called the capillary refill test, and it directly measures how quickly your smallest blood vessels recover from pressure. Here's how to do it. Hold your hand at the level of your heart. Use the thumb of your opposite hand to press firmly on one of your fingernails for about 2 seconds. You'll watch the nail bed go pale or white as blood is pushed out. Then release the pressure and start counting quietly in your head. In a healthy adult with good circulation, the pink color returns to the nail bed in under 2 seconds. If it takes 3 seconds or longer, and you get the same sluggish result when you test 3 or 4 different fingers, that's a meaningful indication that your microvascular circulation is sluggish. Research has linked persistent slow capillary refill in older adults to reduced cardiac output, undiagnosed atrial fibrillation, and elevated stroke risk. Try this test right now, before you finish this video. Perform it in a warm room with warm hands, so that cold temperature doesn't distort the result. A patient named Bernard tried this test one evening after hearing about it and counted nearly 5 seconds before the color returned on his index finger. He tested his thumb next, then his middle finger, then the fingers on his other hand. He got the same slow result every single time. He called my office the following morning and described exactly what he had observed. A full workup uncovered undiagnosed atrial fibrillation, one of the most common and dangerous causes of stroke in adults over 60. He was placed on appropriate treatment, and based on everything we know from current cardiology literature, that call very likely prevented a major stroke within the following year. Bernard had absolutely no other symptoms at the time. Now, let me provide a practical framework for what to do with all of this. I want you to begin today, not next week, not at your next appointment. Take both hands to a window in good natural daylight. Examine each nail one at a time. Check the color of the nail bed for any bluish, purplish, or unusual paleness. Look at the tip of each nail for that characteristic reddish band signaling Terry's nails. Look for horizontal white lines across the nail that you can see but not feel. Check for any deep horizontal grooves that might be Bow's lines. Look for tiny dark lines beneath the nail surface that have appeared without any trauma. Examine the base of each nail for the lunula and note its color and size. Then, perform the capillary refill test on at least 3 fingers and count the seconds honestly. Write down what you find. This step matters more than most people appreciate because these changes are slow and gradual, and human memory is notoriously unreliable over months and years. A photograph of your hands taken today in natural light gives you something concrete and honest to compare against 6 months from now. If you observe one of these signs, mention it at your next routine appointment. If you observe 2 or more of these signs together, don't wait for your annual checkup. Call your doctor's office this week. Describe what you saw and ask whether you should be evaluated sooner. One more thing before I close. Please don't use any of this to diagnose yourself. What these signs do is give you a reason to have a specific and informed conversation with your doctor. The full clinical picture, your history, your medications, your other symptoms, is what produces an accurate diagnosis. Your job isn't to diagnose. Your job is to notice, to document, and to speak up. That's the part most people never do. And it's the part that makes all the difference. Your nails have been sitting at the end of your fingers throughout your entire life. They've been taking notes every single day on how your blood is flowing, how your heart is working, and what your smallest blood vessels are doing. The only thing missing was someone telling you how to read what they've been recording. You now have that. Use it. Share this with someone you love, because the next person who watches it might be the person who spots something on their own hands tonight and makes a call that saves their life. I'm Dr. Dan Carter. Take care of yourselves. I'll see you in the next one.